My name is Jennifer, and I will be presenting a patient to my preceptor. The patient is a 53-year-old female complaining of a sore throat, ear pain, fatigue, frontal headaches, and purulent nasal congestion. Her symptoms began about 10 days ago, and she's been using throat lozenges and Tylenol for symptom relief. She denies any sick contacts. On exam, her frontal and maxillary sinuses are tender to palpation. Her submandibular lymph nodes and her anterior cervical lymph nodes are tender and inflamed, and there's fluid present behind both tympanic membranes. Her vital signs are normal, and she is afebrile. Strep, COVID, and flu swabs were run, and they were all found to be negative. To narrow down some differentials, I'm thinking that it's an upper respiratory tract infection that's either viral or a bacterial sinusitis cause. Her sore throat and rhinitis do support a viral upper respiratory tract infection with those symptoms. However, her symptoms have persisted well beyond 7 days without any improvement. So that's less likely a viral cause, as those symptoms would have improved at this point in time. So that leads me more towards a bacterial acute sinusitis diagnosis, also because of her sinus pain, getting frontal headaches, and having purulent nasal drainage. Also, her strep, COVID, and flu swabs also came back negative. To probe my preceptor, I would ask what helps you differentiate between an upper respiratory tract infection that's viral versus bacterial. And the plan for this patient would be to prescribe Augmentin for 10 days to treat the sinusitis. I would also recommend some other over-the-counter medications for symptom management like Mucinex, Flonase, and some saline nasal spray. And then I would also recommend general increasing her fluid intake as well. If her symptoms don't resolve, I would want to instruct her to follow up with us again and come back in. And then for self-directed learning, I do want to better understand the differences in the symptoms associated with a viral upper respiratory tract infection versus one that's bacterial, because I often associate an upper respiratory tract infection with a viral cause. So I just want to get better at differentiating between the two.